Now, what is ovarian reserve? The first thing everybody should know about ovarian reserve is ovarian reserve is the number of eggs a woman is born is has. That means that who's left with. Suppose a person, we do a test for understanding how many eggs are left with, and if you have a count of it, and we tell you that this is called your ovarian reserve, this is the ovarian reserve of that individual, which will determine the fertility and the reproductive outcome of that person. So it's very important for all of us to understand that a woman who has a low reserve or a low egg count has to initiate her treatment faster than others. So how do we know that this is a low egg count? The question is, the importance is because what happens is a woman is born with certain number of eggs. Not all women are born with same number of eggs, and the fertility potentials of each person differs from one to one. So suppose a person who has a good fertility potential, somebody can conceive even up to 45 years of age, but there are women who struggle to conceive even they're about 25 years of age. And why does it occur? Because a woman who is born with about almost 2 million primary follicles or primordial follicles are the number of egg counts at the time of birth. By the time when it reaches when she starts menstruating or reaches puberty, what happens is she's left with about 4 lakhs. And by the time she reaches to menopause, all these egg counts slowly start decreasing. So for some people, we do not know, for many of us are still unable to find out a reason. When there is in 10% of population, there is an accelerated loss. So a woman loses her fertility potential as she ages. So there is a possibility that at the age of 18 to 30, we are seeing that we have the best number of eggs and the best quality of eggs. But after 30 to 35 years of age, there is an average quality and average number of eggs, and there is a strong decrease at about 35 years of age, when such kind of a situation occurs that we will be left with very little eggs. And at this point of the time, we should understand one more important thing is, a woman as she ages, after 35 years of age, there is a possibility that the eggs which she's left with are not genetically competent. So many of the women who conceive after 35 years of age have a problem with, first of all, problem with conceiving, and even if they do conceive, they have a lot of miscarriages also. So this is so important for us to understand that a woman's potential is the count of her eggs, and the count of her eggs is nothing but the ovarian reserve. So how
Right.
many eggs she is left with? So these are the important things. Now, if you want to actually know the causes of decreased reserve, why, ma'am, I have a very low count? Why does my sister
Right.
doesn't have a low count? Many people ask me this question. My mother has conceived very well. She didn't have any problem, madam. She conceived me when the age of 21. Yes, that is the key. We do not know why in some women there is an accelerated loss of eggs. Every month there is almost about 2% loss of eggs in every woman. That is why
Oh,
age is a major factor, Purnima. I tell you, it's a major factor for us to determine the fertility potential. And even the other causes can be many causes. The lifestyle changes which have occurred in the recent past, last 20 years of, before 20 years, there were not too many lifestyle changes in any of. Smoking has increased in women. We see a lot of women smokers. We see that they're exposed to radiations, the screen time, most of them are working in the IT industry, and sleep is a major important role because most of them are working in the nights, and there are people have poor dietary habits. There are a lot of junk food is eaten in these days, and there's no time for exercise. And stress for the generation is a major factor, because stress is the most important factor which causes a lot of inflammation in the body. And oocyte, or the egg, is also a cell. So any cell
right.
which undergoes any kind of stress will definitely lose its potential to actually generate something good. And of course, many times many women have something called as pelvic endometriosis. We call endometriosis is a subject where many people know it. people, at least who people who have undergone the infertility treatments, or women who have had issues with severe pain during. These are the women who have endometriosis, and this kind of endometriosis can also be a deterrent for the low ovarian reserve. So what happens is, even pelvic infections. So many women have pelvic infections, white discharge, a little bit of itching, and they come to us, and we have seen that many people who have this chronic infections, or getting the infections again and again, these are the women who actually fall into a category where they can have low ovarian reserve. And we should not undermine the importance and the importance of tuberculosis in our country. Many people think tuberculosis, ma'am, I don't have any cough, I didn't have anything. This is not pulmonary tuberculosis which occurs for the chest. It is an extra pulmonary tuberculosis, or a tuberculosis of the uterus and the fallopian tubes. So what happens in this kind of condition is that when the tuberculosis happens, it destroys the uterus, it destroys the ovaries, and it destroys the lining of the endometrium, or the lining of the uterus. We call it as endometrium. So all these factors can bring down the ovarian reserve, or ovarian potential of a woman. And acute stress, there can be chronic illnesses. Let's not forget there are cancers. Many young women have cancers, and they have to undergo there, because life is more important than the reproductive function at that point of the time. But we have the ability to save the eggs also in such cases, but still these women, after undergoing chemotherapy, have decreased reserve or decreased egg count. So these are the causes.